Hi, this is Deb Berkey. Thanks for stopping by. Today we're going to consider using moderate to vigorous physical activity as a metric in teacher performance assessment and evaluation. We know you're busy, and we're glad that you are spending a little bit of time to learn about this exciting concept. Sometimes I think that we are the elephant in the middle of the room, precariously balancing the biggest thing in the room because we really are the most important, because health and physical education literacy are central to success in student performance. But a lot of times we get information that takes us this way and that way, and it's pretty easy to kind of get bewildered and confused. And so on top of that, when you are faced with teacher assessment, all the things that you have to do, you might feel like this fella here. Your evaluation will be based on what you do in the next 30 seconds. Ready? Go. Particularly in physical education. So in this session, I'd like to talk about, well, what is our common mission, regardless of elementary, middle school, high school, or higher ed for that matter. Define moderate to vigorous physical activity as a metric for what it is that we're teaching, and identify ways to utilize moderate to vigorous physical activity data within the teacher assessment and evaluation systems. This is not a seminar to tell you what to teach or how to teach it. It's a seminar to talk to you about how are you measuring what you teach. So what is your mission? They say kids these days are overweight because they don't get enough vigorous exercise. Maybe we should chew faster. We've sometimes fallen out of grace, if you will, in terms of the importance of areas, and I do believe that we are an academic area, in today's schools. So sometimes it's good to, in order to make sure that we legitimize what it is that we do, we have a very clear mission. For me, the mission is provision of developmentally appropriate opportunities that allow students to acquire motor, fitness, cognitive, and personal social skills, facilitating the pursuit of a healthy, active lifestyle. If you want to shorten that up, for me, it's all about making sure that students have the tools to pursue a healthy, active lifestyle. In today's jargon, that would be the support of physical literacy. Physical literacy is defined as the capacity to move with competence and confidence in a wide variety of multiple environments that benefit the healthy development of the whole person. So, boil it down. What's that mean? I want my students to pursue a healthy, active lifestyle. What tools will they need to accomplish that mission? They'll need motor skills, fitness skills, knowledge, and personal social attributes. We're calling that social emotional literacy these days. We have a lot of help with justifying this, i.e., developmentally appropriate instruction, whole child, whole school, whole community, the WISC model, CDC, states and national benchmarks and standards. Lots of input with respect to what it is that we should teach. So I'd like to say to you, when you're selecting your content and when you're thinking about those sorts of things, that you kind of consider the fact that all students are not the same, that they all come with a different genetic potential, and they all have different abilities. That's what makes us different. Fortunately, there's a lot of things that make us the same, and those would be developmental principles like unique to the individual, least to most complex. We develop in stages. We develop hierarchical. Early learning impacts later learning. But there are critical, sensitive learning periods that to which we need to pay attention because we need to provide opportunities, instruction, practice, feedback that allow us to facilitate change in performance. Well, why does that have anything to do with moderate to vigorous physical activity? Well, the point is, whatever it is that you select, you need to be able to define the change in your student. And regardless of what physical attributes you might address or what mental capacity you might be interested in facilitating, or even personal social skill, the opportunities that you provide should be measurable, observable, and controllable, and moderate to vigorous physical activity gives you that capacity. So it's a matter of content versus change. We have a lot of ideas about what content we should provide. And fortunately, things like the WISC model have included us. You don't see math in there, do you? And you don't see spelling in there, do you? If you look at the WISC model, you can see clearly that health education, physical education and physical activity, nutrition, social emotional climate, those are all in there of the 10 that are surrounding the complete well-being of a child. And we've also been elaborated on that a little bit by including Castle's SEL framework as a driver for the content that we select. And finally, we have from states and we have from the national level standards that we should be thinking about that are based on developmentally appropriate activity. So the point is, there's a lot of talk about what we should teach, but not a whole lot of talk about how we should measure it. So in the final analysis, you are still the queen and king of the toy box. Your role is to select that content, which is developmentally appropriate, provided in a way that allows it to be an effective and an impact on your students, facilitating their pursuit of a healthy, active lifestyle. So you know all that. You're the physical educator. You're the person who spends your time in the gym, on the field, on the court, in the weight room. But how are you evaluated on your instructional effectiveness? Is it effort? Is it skills? Is it knowledge? Is it time use? Unfortunately, in some places, those variables aren't even associated with your teacher performance. But we do know, at least in this day and age, at least in the last 3 years, maybe 4 because whenever COVID hit, we do know that best practice now more than ever says that an effective health and physical education program is one that includes SEL because it impacts academic achievement, mental health, the student's well-being, the student's capacity to want to persevere. The point is, we have, as physical educators in particular, the unique position to impact the quality of life for each student. So it's important then that we talk about and think about, how do we measure that? There's a lot of things there. Let's go a little bit further down the road. We're not talking about content anymore. What we're talking about, not directly, what we're talking about is the measurement of whatever content you are providing. The CDC tells us a lot of things. They tell us to wash our hands, to stand 6 feet apart, to make sure you get your immunizations, to stay home if you're sick. But they also say some things as a group, as an organization, about physical education. Specifically, that 50% of a class time, of the time that a student spends in class, should be spent in moderate to vigorous physical activity. There it is, moderate to vigorous physical activity. And how do we measure that? And further, the CDC, as their guidelines for all people, say that children, adults, children, 6 through 17, should on an annual or on a daily basis participate in 1 hour or more of moderate to vigorous physical activity. And at least 3 days a week. Well, that would probably suggest to us that might be useful for us to know something about moderate to vigorous physical activity. I'm not here to debate about how you would choose to measure it. I am here to speak to, well, what is it? And it is an activity that it is any type of physical activity that enhances the function and health of the lungs and heart. And that the recovery rate of the cardiovascular system indicates the efficiency of heart function. If you are a diehard, if you will, exercise physiologist, you would measure that in METs. If you're a physical educator, a typical one, you will be measuring that in beats per minute. So if you take the concept or take the idea that there's a limit to how hard you should exercise, i.e., cardiologists have suggested to me that maybe 200 was the limit, or not maybe the limit, but a stopping point or something to think about in terms of the safety of participation. If you say that 200 is probably the time that I should start to think about maybe backing off or moderating what it is that I'm doing, it would be safe to say that 60% of that, which would be about 120, and 85% of that would be good markers. So without spending a lot of time debating which way would be better to determine that, just take as a general marker 200 beats per minute, 60%, 85%, and what you're going to have is 120 to 175 beats per minute. Now, that said, it should be adjusted for the physiological condition of the student. So if it's an asthmatic or an epileptic or a child who is overweight or a child who is undernourished, you're going to have some various factors there. It's not the point of this particular seminar to address that, aside from to say that you should individualize for the zones. I'm just trying to get you to orient to moderate to vigorous physical activity, and that there are various levels of various zones in which you can participate. And the zoning that we utilize as one of the measures in the Heart Zone system, Heart Zones Move, allows you to actually look across students at the impact of what's happening in your class. Think about it like this. This is an investment in intensity. I can't do anything about the frequency of time that your students spend in a class, how many days a week they get to come. I can't do anything about the time that they allocate you, 20 minutes, 30 minutes, 90 minutes. I can make some suggestions to you about the type of activity that you might want to use. But the bottom line is, whatever type of activity you use, articulating with whatever framework it is that you choose, are your students participating in moderate to vigorous physical activity at least 50% of a given class session? That will drive your content, that will drive your instruction and management, and that will drive your assessment. So let me take all of that and put it into a generic framework for you. You are the first yellow block there on the left. The teacher product is your evaluation. There's some things that happen before you are evaluated or during the time you're being evaluated, and those would be things like those lesson plans, your preparation. How do you prepare to go into your class? Once you're in the class, how do you spend your time? Some of the variables that you spend your time in which you participate are things like observation and instruction and management and feedback. But how does that impact the student? Well, the content that you teach and how you teach it, opportunity, instruction, practice, and feedback, will impact your student. So how is your student spending their time? Students, how are the students spending their time? Are they in motor appropriate activity? Are they in cognitive? Are they in management? Are they waiting? Hopefully they're not waiting, because at the end of the day, when this class is over and you are measuring the impact of the class on your student, you are looking at, again, change in performance. The change in performance can be in motor skills. Change in performance can be the accumulation of moderate to vigorous physical activity, the knowledge that they receive, or the knowledge that is imparted, and the personal social attributes that are developed during that time period. A reflective teacher will take all of that and seek to improve or maintain their performance. But what variables do you have that will allow you to at least begin the discussion of, so how effective was I? If I were a teacher in the public schools these days, or a private school, or a school period, I would probably choose a SMART goal like this one. 90% of the sixth graders in Berkeyville Middle School will sustain moderate to vigorous physical activity. That's at a minimum of 60%. That's my choice. During 50% of physical education class time in 75 out of 80 class days. So that would be for the entire year. You can change the metrics around a little bit as you choose. But the point is, it is something that is observable, it's measurable, it's controllable or manageable, and you can see reasonable results. So if that's my goal, how would I use it? Or how would I get it? How would I accumulate that data? In the Heart Zones Move system, during your class, you can look at the aggregate data of your students as they participate in your class. So if 30 of them are in here, okay, this is a short class, but if 30 of them are in here and I'm looking at this data, I can see the raise. What was I doing here? How did it tank? How come it went down into blue? What was going on in my class that allowed my students to either meet the goal of moderate to vigorous physical activity or not? Did I pick inappropriate content? Did I put the three or four kids together that shouldn't have been there? Was my equipment out? It still doesn't tell me everything that's gone on in my class, but it certainly tells me in an accumulative way whether or not during 50% of my class time were my students in moderate to vigorous physical activity. Well, happily, on this particular day, as you can see in the yellow circle, 66% of the time they were. That happens during the class. After the class, I also have this aggregate data that I can access, and I can look at and ask the same kinds of questions that I did before, except that in this particular instance, I can also take a look at various dates, and that was important just a second ago when we were looking at 75 out of 80 days. The point is, I have more than just data. I have something on which I can base my maintenance or my adjustment of my instruction to meet my goal. But I have more data. I have data here for my students because I have collected moderate to vigorous physical activity, and I have reports for my students that I can begin to talk about cardiovascular endurance. I can talk about the impact of moderate to vigorous physical activity on my exercise patterns or on my activity patterns and the selection of the content that I might use. I can talk about rest. I can talk about the range of heart rate that I would see during my participation in activity. I can see the effort that I made, and I can see recovery. And I can see this in a number of ways. And you can see that there's a lot of different formats that are utilized. And bonus for you as a teacher, this provides you an opportunity for cross-curricular activity. So as I mentioned before, the aggregate data that you had during the class is also summarized for you after the class. This is just a tad bit different format. It's a previous version. But the point here is that you can look at this and make up your mind about activity selection, about your teacher evaluation, did you match your goal that day, and ultimately program assessment. All from the all from the collection of moderate to vigorous physical activity during my classes, in my school, in my gym, on my field. So, how do I incorporate social emotional literacy into this format? Well, the Castle framework gives us it gives us five different options, if you will, with regard to the development of social emotional skills. These are categorized as self-awareness, self-management, and responsible decision-making. That's three of the five. If I categorized moderate to vigorous physical activity as an achievable goal, and I utilized that data within my assessment framework, I would also be teaching students, I would also be impacting the social emotional skill set that they have. For example, a secondary student could demonstrate self-management by attaining a minimum of moderate to vigorous physical activity parallel to what you have as your goal. And why would I include that? Well, as you can see, self-management includes self-motivation and goal setting. Self-motivation as in best effort. It also includes responsible decision making. I chose self-management for this particular example, but you can see that you could utilize evaluating and reflecting over within the responsible decision making variables or elements. But on the left hand side, you can also see that I've provided you a point value that you might utilize in your overall scheme of evaluation. I can do the same kind of thing in an elementary setting, but this time I would use self-awareness, and I would use my self-awareness, accurate self-perception as in best effort, that would allow me to attain or aspire to participate in class to the level of 50% during those days. I could translate that then into this metric, this rubric that I have here, that I could utilize the point system that I had in the previous slide. That's a general or a generic way of looking at this, regardless of what I might use, whether it's Danielson or another method. The general components of an evaluation system could be characterized in the Danielson framework. Danielson has four domains, and you can see that in general they are planning and preparation, the classroom environment, instruction itself, and professional responsibilities. Many school systems use this as a basis for their own generic or their own personalized assessment system. For example, Marion County in Florida took this same thing as a framework, and they pulled out the variables that they wanted to choose and gave them weights. You can see the domain weights, and they established a performance rating which has a rubric to it. And you can see underneath there I have placed some selected variables that you could utilize, which articulate with moderate to vigorous physical activity. If we look at this systemically with the Danielson framework, you can see that if you use moderate to vigorous physical activity, and specifically today, heart zones, move, that your planning and preparation could be addressed by the utilization of moderate to vigorous physical activity and the individualization of zones. You could also demonstrate knowledge of resources utilizing the FIT principle. For the classroom environment, you could utilize class expectations and space utilization, i.e., how do you not just manage the class in general, expectations as far as handing out equipment and doing those sorts of things that are associated with the heart rate monitors. You need to be responsible, you need to be reliable. There's several different types of variables that you could tie in here. Instruction, you're using a big screen and pacing and fit points. You have the data on which you can use as a basis for communicating with students. You're engaging students in learning by the use of the big board. You're using assessment and instruction because you can show the students at a glance how much time they are in moderate to vigorous physical activity, as well as the whole class. You're demonstrating flexibility and responsiveness, again by individualizing zones. And finally, you can address the professional responsibilities quadrant by talking about the reports that you receive from the utilization of moderate to vigorous physical activity, utilizing the portal, and networking. Because you have accurate records of what has happened in your classes, you're communicating with families if they choose to access the data in the portal, or you have those reports sent home. And you are demonstrating a professionalism by going outside and participating in the professional community to learn how to use the Heart Zones Move system. But best of all, you can reflect on teaching utilizing a metric that cuts across fitness, standard 3, standard 4, which is personal, social, or social emotional literacy, and 5, which is social emotional literacy in the community. Heart Zones Move provides you a tool that allows you to be accountable, allows you to provide assessment, it's affordable, and it provides a form of advocacy. Probably the best thing about it, aside from the fact that you can actually be accountable by something that is actually driven by real time, driven by authentic participation, is that you have the capacity, the opportunity, if you will, to integrate data, which across the board will allow you to incorporate moderate to vigorous physical activity, your FIT principle, WISC, as well as Castle's framework. Because in the end, we'll start where we began. What's your mission? If your mission is to prepare students to pursue a healthy, active lifestyle, having the knowledge of moderate to vigorous physical activity and applying it to the physical activities in which you participate, i.e., matching personal needs across the lifespan, increases the probability that your students will pursue a healthy, active lifestyle. Most of all, they can see results of what it is that they do, be motivated, and understand that they can change their levels of performance by understanding the impact of physical activity on their bodies. Thanks for coming. You're awesome.